SportsMags.com.
It is estimated that there are nearly 2 to 4 million sports and recreation-related concussions that occur in the United States every year. High school football accounts for 47% of all reported sports concussions, with 33% of concussions occurring during practice. After football, ice hockey, and soccer pose the most significant head health risk. Joining us this morning with more on what parents need to know as their kids get ready for fall sports is Dr. Seetharama, Chief of Physical Medicine and Rehab at Hartford Hospital. It's great to see you here, Dr. Seetharama.
Thank you for having me.
Many people don't really know what a concussion is. Let's talk about what is that, first of all.
So, I deal with adolescent and pre-adolescent concussions, so I want the parents to be aware it's a hit that can be direct or indirect, and it triggers a pathophysiological response in the brain, and the brain starts healing itself. So initially there's a loss of blood flow, there is starvation of energy, and there is all kinds of chemical imbalances going on.
What kind of questions should parents be asking their children, especially when they're young, as to find out what it is exactly that they're going through?
So the typical thing is the kid's playing or practicing. So who's aware of the hit? It's the trainers, it's the coaches who are right on the sideline. So we are working with them to recognize these kids getting concussions. And one of the most important things I want people to understand, and even parents to understand, is the kid might come back off the field and say, I'm feeling fine.
Exactly.
But doesn't mean he doesn't have a concussion, because there can be a delayed effect in 5 minutes, in 10 minutes. And sometimes they'll say, I got into the car after the game and I had a severe headache and I fell asleep in the back seat of a car. So if you notice an injury and you think it was a headache, take the kid out. A famous coach once said, when in doubt, take him out.
So you need to keep asking the child questions continually, because the symptoms could manifest later.
Correct. Now we have sideline testings, and we have done a lot of studies, and they are saying that the sideline tests are missing more than 20 to 30% of the concussions. So it's not a very exact science. So you have to use your experience and check the kids out and let them sit and retest them before you send them back in.
So why are we missing that diagnosis at the sidelines? What's not being done?
So here it is. When you get an infection, we can test it. We can say what bug you have. We can treat you with the appropriate antibiotic. We don't have a blood test. We don't have an x-ray. We don't have a CAT scan that can tell us that the kid has concussions. Everything we do right now is based on subjective analysis. The tools we have are all based on what the kids are saying. Now, you know, you watch professional sports, how many concussions are missed, and I could be sitting watching TV and say, oh, that's a concussion. Klay Thompson in the game against the Golden State Warriors 2 years ago. We were sitting watching the game. We said he had a concussion.
But he's still playing.
Oh, they said, oh, he had a cut in his ear. They tapped his ear and they brought him back into the game. So it's a hard thing to recognize. But like I said, overreact. Let them sit. Let them test them. And if they're better, get them back in the game.
Just really quick, I just want you to weigh in on this. The imaging that some schools are looking at having their students take before they go out and play sports, that pre-image where you get a good idea as to what your brain looks like before concussion, is that something you support?
In my knowledge right now, there is no validated imaging study that can tell us anything about concussions. I've been doing this since for 11 years now, and I can probably count the number of kids I imaged, because the kid wasn't recovering. They were 2 years post-concussion. And we concentrate on getting these kids back to school more than play. Remember, only about 10% of kids make Major League Baseball, 1% of kids make professional football. These kids are going to be part of the workforce. They're going to get an education. That's what we are concentrating on. So there were a couple of cases we did, we call it diffusion tensor imaging and specialized imaging. But the results were not helpful at all.
Right. Dr. Seetharama, thanks so much for sharing all this information. I know a lot of parents are listening to what you had to say.
Thank you very much for having me.
And let's go to the kitchen. What's on the menu today, Laura?
Oh, Jocelyn, the kitchen smells so fresh right now. We are hoping to make everyone's life just a little bit easier by showing you how to make an 8-minute meal the whole family will enjoy. Today we have April Godfrey here joining us, making a cucumber noodle salad with walnut pesto.